Hi everyone, welcome back to my channel. I remain your obstetrician gynecologist, Dr. Nkiruka Bridget at OBGYN Talks with Dr. Adazion. Thank you for subscribing to my YouTube page. Thank you for following me on Facebook, all at OBGYN Talks with Dr. Adazion. I'm also on TikTok and on Instagram. Thank you. Today I'll be telling us about signs of ovulation. Signs of ovulation, these signs will tell you either that you are about to ovulate, or that you are ovulating, or that you have ovulated. And it will help you to plan your pregnancy or to use as a form of family planning. Whatever you want to use it for. I promise you that these symptoms and signs will be so necessary for you. Thank you. If you have not subscribed, please subscribe at this point. Hit the notification button. Look for me on Facebook at OBGYN Talks with Dr. Adazion. So let's go on. Signs of ovulation. They are up to 12 to 13 in number. Before this, you need to study your body, because it's when you have studied your body very well, these signs will be good and easy for you to dictate. So let me go on with their next list. This is me. Signs include change in cervical mucus, increased basal body temperature, ovarian aches and pain, increased libido, spotting, breast soreness, change in the cervical os position, that's the mouth of the cervix, increased high sense of smell, thickened endometrial lining, bloating, breast soreness. Then when you use ovulation test kit, it will read positive, and if you use ultrasound, it will show that there is follicles or a Graafian follicle that is about to rupture. So follicular tracking is one of the things that can be used to find out when someone ovulates. So I'm going to take it one after the other. So before I go on, it's necessary that you know you have to study your body before you can make use of these signs, these symptoms I'm about to teach. You have to be aware of what happens in your body. So you must have taken time to find out how your body works. Now, let's take the first one, change in the cervical mucus. When I explained about how to get pregnant and how to boost infertility, I talked about the cycle length. For a normal cycle length, we say it's between 21 days and 35 days. So for someone that has a normal cycle length, at the beginning of after the menses, just immediately after the menses, the cervical mucus is small in quantity and thin. But towards ovulation, they become copious. Now, they are so thin and stretchable. They are copious, thin, stretchable, that you can even form a stretch with it, and it's very clear. It's a sign of ovulation. It happens mostly between 16 to 36 hours prior to ovulation. So when you notice a change in cervical mucus, it means that the person is either about to ovulate or is already ovulating. Why the cervical mucus changes is so that it will be easy for the sperm cell to permeate and be able to move to the fallopian tubes to fertilize the egg. So this is one of the signs of ovulation. Let's go to the second one, increased basal body temperature. The normal temperature of an individual remains the same following menses, but immediately after ovulation or just at ovulation, because of the effect of progesterone, the basal body temperature increases by about 0.5 degrees Celsius. So it may be difficult for some individuals to notice this, but for someone that is so keen about what happens in their body, or someone that keeps a temperature chart, you will notice that there is increase in basal body temperature just following ovulation. So it shows the person has ovulated. Then increased libido. It is the mother nature's way of causing more procreation so that our species does not go into extinction. You notice that when someone is ovulating, just at that time she's ovulating, she has increased libido. She aims for intimacy, and she's even when prior to that she's not interested. At that time, there is increased libido. She aims for intimacy, and that is the way the nature has made it. so that the person can go on to continue to procreate our spaceship. Now let's go to heightened sense of smell. The hormones responsible for ovulation makes it easy for the female gender to look for the male gender. That hormone called pheromone. The pheromone it helps you to attract the next person. So there is increased heightened sense of smell for someone that is about to ovulate. Now for spotting, that's the next one. Spotting happens following the rupture of the Graafian follicles. Just because of the rupture, there may be some blood that will follow it, and that is taken to the uterus and passed out. But most times, because it has stayed long before coming out, it may be brownish in color. Not everybody sees spotting, and spotting does not happen all through the cycle. So it's just at the time of ovulation. If it persists, the person should seek for medical attention. Now, ovarian pain or ache. Most people call it mid-cycle pain. Some women will experience pain on the side of the rupture. The side the egg is being released. If it's on the right, you feel the pain on the right. If it's on the left, you feel the pain on the left. It is a mid-cycle pain. It shows that the person has ovulated. Some other women will go on to feel aches around the waist because of the fluid that follows that the egg when ruptured. The fluid settles in what we call the pouch of Douglas, and those people, so some women will feel ache around that time in their waist, but it's short-lived. It's not something that stays all through the cycle. So these are signs of ovulation. Please, if you have not subscribed, this is the point to subscribe. Thank you. Also, at the time of ovulation, if someone has been keen in monitoring the position of her cervical os, that's the mouth of the uterus, the cervix, you will notice that at the time of ovulation, the cervix is drawn up. Because it's drawn up, is a sign that the person has ovulated or is about to ovulate. And it becomes soft. It's as soft as the tip of the nose. So this can be checked through the vagina. It's not something you check through the abdomen. Someone can help you, an obstetrician can help you determine that. Then the next is bloating. So that most women at the time of ovulation or after they have ovulated, they feel bloated up. Their abdomen looks big. They will look as if there is fluid in their body. It's not a cause for alarm. It's because of accumulation of fluid in the body due to the effect of progesterone. Is a sign that the person has ovulated. It doesn't last long. When the menses starts, it will go. Now, the next is an increase in endometrial lining. Following menses towards ovulation, the endometrial lining becomes thick and it continues to grow thick. This is in preparation for an incoming egg. Peradventure, there is fertilization. So the endometrium is the womb where the baby lies. It becomes thick, preparing to accept any fertilized egg so that it will be comfortable for that baby to grow. That is another sign that someone has ovulated. Then the next is breast soreness. Breast soreness, at the time of ovulation, some women feel tickling at their breast, at their nipple, and this goes on to increase to soreness. It shows the person actually ovulated, and it's because of the effect of hormones of the body, hormones that is responsible for ovulation, including progesterone. Then the next is when ovulation test kit is used, it shows positive. It picks actually the luteinizing hormone, the hormone responsible for ovulation. So it will read positive about 24 to 36 hours just prior to ovulation. And some will just read 2 lines, others will show a smiling face, showing that the person is about to ovulate. So for someone that is desiring fertility, you can get these kits and keep at home and use it to monitor your time of ovulation so that at least timed intercourse will be used at that time. Then follicular tracking. Follicular tracking, we use it especially in the hospital for someone that we're not sure she's ovulating or someone that we are tracking to give them timed intercourse to know actually when they ovulate. Is by the use of ultrasound. A transvaginal probe is used, and it started from the 10th day of the menstrual cycle and is done on alternate day till the Graphian follicle, the follicle, because at the beginning you will see many follicles, you may see 2 or 3. Then as the time goes on, as the monitoring continues, you now see that one Graphian follicle is out, one is out, or at most 2, or for those that are going to have triplets, 3. You now see it, and you will note when they rupture. If they are up to this level this time, the next time you will not see that level again, showing that that follicle has ruptured. So amongst these are the things that you can do to monitor when someone ovulates, to find out if the person has ovulated, whether the person is about to ovulate, or whether the person actually ovulates. You can use it to plan your pregnancy. For someone that is not yet to have babies, you can use it to plan when you want to get pregnant. If you notice this sign, you can avoid intercourse as much as possible. But someone that is desirous of pregnancy, you notice this, you know that something is about to happen, and you can go on to have your intercourse so that you can have your pregnancy. Thank you for watching to this point. Please, if you have not subscribed, subscribe to my YouTube channel at OBGYN Talks with Dr. Adazion. Follow me on Facebook page at OBGYN Talks with Dr. Adazion. I'm on TikTok and on Instagram with the same name. Grow this channel. Let's continue our discussion. Thank you. I love you all.